Hi. In some of my last videos, 2, 3 videos, we have discussed about ableist norms and ableism among healthcare professionals. Let us see how the healthcare professionals can learn about disability etiquettes and how much they do need to learn about that in this video. So if you haven't subscribed to my channel, please do so, like the video and share. So let us learn about disability etiquette. Disability etiquette refers to a set of guidelines and practices that medical professionals can follow to ensure respectful and inclusive interactions with individuals with disabilities. And here are some key considerations for the healthcare professionals regarding disability etiquette. First of all, they need to use and learn first. Use of person first language. Put the person before the disability when referring to individuals. For example, say a person with disability instead of disabled person. This emphasizes individuals' identity and humanity rather than defining them solely by their disability. And stop using words like handicapped, specially able, and so on and so forth. Then ask for preferred communication methods. Inquire about the preferred communication methods of individual, especially if they have speech or hearing impairments. Some individuals may prefer sign language, written communication, or assistive communication devices. So respect their choice and make necessary accommodations for them. Be patient and allow sufficient time. Some individuals with disability may require additional time to communicate or complete tasks. So be patient and listen attentively and avoid rushing interactions or making assumptions about disabilities. Respect personal space and assistance. Always ask before providing assistance to an individual with disability. Respect personal boundaries and allow them to indicate whether they need assistance or not. Avoid making assumptions about their abilities or independence. And do not stress on bringing a caregiver with them. Ensure physical accessibility. Maintain an accessible environment by providing ramps, wide doorways, accessible parking, and appropriate examination tables or chairs. If a barrier exists, be proactive in finding solutions or alternatives to ensure individuals' comfort and safety. Then you need to provide clear and accessible information. Use plain language and clear explanations when communicating medical information. They are not educated as you are, and they don't know medical terms as you know. So provide written materials in accessible formats such as large print or electronic versions when necessary. Respect privacy and confidentiality. Treat all information shared by the individuals with disability with the same confidentiality and privacy as any other patient. Avoid discussing their disability or medical condition in public areas unless necessary for their care. And be open to accommodations. Inquire about any specific accommodations or modifications needed for effective communication or access to healthcare services. Be open to making reasonable accommodations to ensure equitable care. Treat each individual as an expert on their own experiences. Patients are sometimes more expert on their conditions than you are. So recognize that individuals with disabilities are expert on their own needs and experiences. Listen to their insight, don't impose yours. Respect their perspectives and involve them in decision-making processes regarding their health care. Continuous learning and self-reflection for you would be helpful. So commit to ongoing learning about different types of disabilities, disability rights and advancements in accessibility. Reflect on your own attitudes, your own biases and assumptions, and actively challenge ableism to provide more inclusive and patient centered care. Remember, disability etiquette is not a one size fit all approach, as individual preferences and needs may vary. It is important to communicate openly, ask for guidance when needed, and approach each interaction with empathy, respect, and willingness to learn.